MedCram.com.
Welcome to another MedCram lecture at MedCram.com. We're going to talk today about eosinophilic pneumonias. This is a topic that can be a little confusing because there's a lot of different entities that have eosinophils in them. But before we do that, let's talk a little bit about the immunology of eosinophils. And for that, let's kind of review a little bit here. We've talked about the antigen-presenting cell in some of our cell talks. Remember, the antigen-presenting cell is going to have an antigen on its surface, and it's going to present via the major histocompatibility complex 2 to a T cell, and specifically it would be a Th2 cell, which has a CD4 receptor for the major histocompatibility complex, or MHC2. Okay? Now, that Th2 cell has a choice in terms of the kind of cytokines and interleukins that are going to be secreted. So one of them could be this IL-4, which is really important with plasma cells, because what it does is it takes B cells and causes them to turn into plasma cells and make IgE. And we can actually hit that antibody with another antibody called omalizumab. And so we can block the effect of that IgE. Well, another interleukin that the Th2 cells can produce from that antigen is IL-5. So IL-5 directly recruits eosinophils. It's got a nice blue nucleus, and then it's got these pretty large granules, and usually it's a bilobed nucleus. And so this IL-5 can also be blocked with mepolizumab. So just be aware, APC, antigen-presenting cell in the airway, combines with a Th2 cell via a CD4 MHC2, and then the Th2 cells, which are T4 cells essentially, can make either IL-4 or IL-5. The IL-4 goes on to make IgE, which we'll see a lot of, and the IL-5 goes on to make a lot of eosinophils, or to attract them. So let's talk about the different entities, which all have one thing in common, and that is they are associated with eosinophils. Okay, so we've got the airway here. Let's divide that into airway and parenchyma. So what are some of the diseases of the lungs that have eosinophils in it? Well, the first one that comes to mind is asthma. So if you were to go down and look, you would see eosinophils in asthma. There's no question about it. It is the majority of the cell type that is found in the airway. Remember, with COPD, we saw neutrophils, and these neutrophils were attracted by IL-8, whereas these eosinophils are attracted by IL-5. Another thing that you could see there is eosinophilic bronchitis. So bronchitis without asthma, but you take a biopsy or you take a sample of the airway and you see a lot of eosinophils. Bronchocentric granulomatosis is also have eosinophils. Of course, you'll also see granulomas. The final one that we want to talk about is allergic bronchopulmonary aspergillosis. So let's clear the screen and look a little bit more carefully at this disease entity, because I think we need to talk a little bit more about this one. So let's talk about ABPA, allergic bronchopulmonary aspergillosis. So what you need to know is that ABPA can occur in people that have bronchiectasis, which is basically dilatation of the airway, which is a great place for fungus to hang out. And what you see is the fungal elements cause an allergic reaction. And the most typical one, of course, is aspergillus. That's why it's in ABPA. But you can have other types of fungus. But the most common one is ABPA, and that's the one that they would show you on a test. So be aware that anything that causes bronchiectasis, like cystic fibrosis, is going to be what you're going to see. Now, what are you going to see on X-ray? Okay, typically it's going to be in the upper lobes, and it's going to have this finger glove type of pattern. Okay, so in other words, the bronchi come out and you get this inflammation and bronchiectasis around it. So finger in glove and its upper lobe. And so what are the real diagnostic elements that you're going to see? Let's go to something a little bit brighter to write down what the diagnostic elements are. So the first thing you're going to see is a skin test that's positive for Aspergillus. The rest of the three are all serum blood tests. So the next thing you're going to see is a positive serum precipitans to Aspergillus. The third thing that you're going to see is an IgE level that's very high, usually greater than 1,000. And then finally, you're going to see antibodies, if you will, to Aspergillus IgE and IgG. So you don't need all four of these things, but typically you'll see 2 or 3 of these things. And when you look on the CT scan or high-resolution CT, you'll see bronchiectasis. Okay, but typically it's going to be in the upper lobes. A lot of times we see it in the lower lobes in other types of diseases, but here we see it in the upper lobes. Okay, so what's the treatment? Steroids. Even though this is Aspergillus and we're worried about invasion and bleeding and things of that nature, because this is an allergic reaction to fungal elements, the primary treatment is steroids. Now, plus minus, you could also add itraconazole, okay, which is actually an antifungal. But they may ask you which is the more important medicine to add, steroids or itraconazole, and steroids are the most important things to add. Okay, I want to talk to you about Loeffler syndrome before we move on to the most important eosinophilic diseases. This can be caused by just a number of different types of issues. It can be caused by drugs. It can be caused by parasites. Okay, so typically you'll see on the x-ray a fleeting infiltration, fever, cough, and what I want to show here is a distinction about where you find the eosinophilia. So typically you can find the eosinophilia in the lungs, and you can find the eosinophilia in the blood on a blood test. Now that's not always the case, but I want to make it clear that when that is the case, I'm going to write both. So both means that it's going to be both in the lungs, for instance on a bronchoscopy, or in the blood. And you would see that in Loeffler syndrome in both. So think about Loeffler syndrome. The other one that I want to talk about is Strongyloides. Here, you could get an infiltrate. Of course, this is a parasite. Strongyloides is a parasite. And again, you're going to see both eosinophilia in the blood and also in the lungs. In fact, just about all of the diseases that we're going to talk about, there's eosinophilia in the blood and also in the lungs. There is one exception to that, and that is with acute eosinophilic pneumonia, which we haven't talked about yet. But the key here is both Strongyloides and Loeffler syndrome can result in eosinophilia, both in the blood and in the lung. Okay, so join us for the next video where we're going to get into the more testable material on eosinophilia, specifically eosinophilia in the lung parenchyma and their distinctions, because there are some fine distinctions. Thanks for joining us.